My name is Rhema Vaithianathan. I'm a professor of health economics at the Auckland University of Technology. My area of expertise is looking at data and at health, and particularly in children. I'm passionate about my area of work because I think at childhood is where policy can really make a huge difference and can protect children from intergenerational transmission of disadvantage. That's really our opportunity to intervene between the circumstances in which a child is born and the circumstances in which they live. My work relates to the work of Health and Wellbeing Queensland by their interest in understanding how child obesity that is rising in Australia is going to affect life expectancy and other outcomes for children born in Queensland today, the 2023 cohort. So the key aspect of my work that are going to positively impact Queenslanders is showing Queenslanders what the life expectancy reductions might be for children born today if we don't do anything about the relentless increase in obesity of every generation born. The beauty of this work is it gives you a certain social license, a kind of a requirement to act. And as a community, it galvanizes lots of different departments, which is what Health and Wellbeing Queensland is doing, is galvanizing departments across the state to try to address the same issue together, which is childhood obesity. So based on my presentation, I suppose three key facts that people might be surprised about. One is that if we do nothing about it, obesity in new generations might mean that they actually live a shorter time than their parents. In fact, longevity might be reversed by almost 20-year improvement in life expectancy that we've seen in Queensland. The other thing that is interesting is just how much can be done if we have childhood obesity. So what we've shown is that if children born today end up looking like children born in the 70s and 80s, we're fine. So when you remember 70s and 80s, it wasn't that different to now. There are a few key differences. If we reverse those few key differences, we can actually restore the life expectancy improvements that we expect our children to have. So the one thing from my presentation I'd like people to take away is that we have to stop talking about obesity as an issue of personal responsibility. We have to understand that the challenge is the environment in which parents are bringing up their children. It's the fact that it's just so much harder today to parent children into a healthy weight than it was in the 70s and 80s. And there's a reason for that. It's because there is higher levels of trans fatty acids in our food. There is higher sugar content in our drinks. These are all things that can be done and change through regulation, and we have to demand that regulation. The one thing we can do, at least in child obesity tomorrow, is call your school board and ask them, what are you doing to restrict sugary drinks in school grounds? What are you doing to increase activity of your kids when they go to school? So demanding that MPs, school boards, city councillors start taking obesity seriously is the thing I really want to see people doing. So one thing I'm really optimistic about is because in Queensland we have the Health and Wellbeing Queensland with a very clear remit, which is to provide leadership on the issue of obesity and particularly childhood obesity. I think that hasn't been tried in many other places, to have a single agency with a really single clear remit. That's what I'm really think when I come back in 5 years, I'd love to see that having been met its potential, which I think it will be.